All right, my name is Caitlin Stearns. It's nice to be with you this morning. I am a medical assistant. I have worked at the University of Utah Hospital and Clinics for 6 years, and I've worked at Oregon Health and Science University in their Center for Women's Health. I currently work at University of Utah Hospital in their obstetrics and gynecology department. And I get to share with you today a tray setup for our LARC, for our long-acting reversible contraceptive devices, and supplies and tools, instruments that we use. So moving forward, just beginning with IUD insertion and setup and tools needed, instruments, supplies. Yeah.
Will we get a copy?
Yes, thank you so much. I do have these for you guys to take with you today. So, yeah, that is a lot. So please pass these around. These are for you guys to take with you today, please. Let me know if,
Thank you.
yeah, let me know if there's more copies needed. But please take them home with you. Thank you so much. All right. Well, as we're getting these passed around, we'll just begin by looking over the IUD insertion and our instruments, our tools, supplies needed for that. So we always like to start off with our urine, getting a urine HCG pregnancy test. We typically like to have lidocaine. It is provider preference though. So anywhere from 2 to 10 cc's of lidocaine, typically without epi. You need a syringe, 10 cc syringe, 18 gauge needle to draw up the lidocaine, and then we use what we call a spinal needle, or it's a 25 gauge, 1 1/2 inch. Scopettes are needed, betadine swabs, and then our instruments that we use. So we use a speculum, a tenaculum, uterine sound, cervical dilators, long scissors, silver nitrate, possibly sterile gloves. Again, provider preference. More so with our Paragard IUDs. A few other things, lubricating jelly for our speculum. We use gonorrhea chlamydia swab. Things that we hope to have available for our patients. Hot pads. Also panty liners, washcloths, chucks, ibuprofen, the device itself. So just kind of going over things. Again, washcloths, panty liners, our HCG cassettes. And then just reviewing over. So I'm sure you guys all know what a speculum looks like, right? I'm not sure if I noted that there. Our speculum, we're going to cleanse the cervix with betadine. You know what I did not note here is if they do have allergies, intolerances to betadine, shellfish, there is like HibaCleanse. There are alternatives to use to cleanse, prep. We want to, if provider preference again, available lidocaine. So again, just needing a syringe, 10 cc syringe. We need a 18 gauge needle to draw up, or at least something to draw up the lidocaine. And then we use spinal needles, or it's a 25 gauge 1 1/2. We need a tenaculum to grasp the cervix. Uterine sounds that are available. We have disposable uterine sounds. We do have our metal uterine sounds, those that we can sterilize. Cervical dilators. The device itself. Long scissors, cut the strings. Available silver nitrate to help with bleeding. And then scopettes. Lots of scopettes available. So that is our tray setup for insertion of IUD. Any questions with insertion? Supplies, instruments needed there? Okay. IUD removal. Really for IUD removal, as noted there, this is IUD insertion at the bottom. Last thing, kind of just removal, is the ring forceps. However, let me show you just a few extra tools that we need. Again, your speculum is needed. Sometimes we like to offer what you're seeing here. This is like a little, you see them with your pap smears, right? These are your cervical ECC. Sometimes if the strings are hard to find, those can be helpful. Your ring forceps. Sorry, that was our little ECC. Ring forceps. We have IUD hooks. Alligator clamps, as you'll see there. Also not noted here, sometimes we use like a long hemostat. That can be helpful as well. And then always just making sure that we're offering washcloths, panty liners, if available, those little hot pads. Those are so helpful. Whatever we can offer to make it a little bit more comfortable experience. Any questions with IUD removal? Yeah. That's a great question. Provider preference. I have heard it offered, and I have heard it taught by providers, how you can self-remove your IUD. But I think it's provider preference and how comfortable they are with that and how comfortable patients are with that, right? Have anyone experienced that? Have you guys had your patients ask you if you can self-remove your IUD? Yeah, it can be done. Yeah, great questions. Any other questions with removal of IUDs? Okay. Our implants, we hear them as Nexplanon. And our insertion, supplies needed, tools needed. Always our pregnancy tests, right? We want to make sure, rule out pregnancy prior to doing any of our contraceptive devices. So our urine HCG cassettes. We do need betadine. Again, I'm sorry, I didn't note if they do have intolerance to betadine shellfish. There is alternatives. Hibiclens is one. Lidocaine is needed. Our 10 cc syringe, our 18 gauge needle to draw up. Noted here, it's a 22 1 1/2. Again, we call it or spinal needle. I know that sounds kind of scary, right? A spinal needle in your arm. But it's just the appropriate length. It actually is a 25 gauge 1 1/2 that we use. We need just 4x4s. We use Band-Aids, steri strips, Coban, Band-Aid scissors, again a chucks to lay down, and then possible sterile gloves. Again, it's provider preference, and then device itself. So, again here, our cassette, our urine pregnancy test, our iodine, our betadine swabs, just our syringes, needles, again, I know that's kind of scary, spinal needle in your arm, but that's what we've called it. 25 gauge, 1 1/2. Lidocaine typically is just plain lidocaine, 1% plain lidocaine without epi. And then the device itself, Band-Aids. We use Band-Aids, steri strips, our 4x4, gauze, and Coban. Any questions with insertion? Supplies, tools needed for insertion of the implant. And then removal of the implant, or Nexplanon. So again, we need to make sure that we're cleansing. We're using our betadine, our Hibiclens. Lidocaine is needed for removal of our Implanon, Nexplanon, using our syringe, our needles. Our hemostats are used. We use small curved hemostats or straight hemostat, mosquito hemostat. Some clinics, maybe if you have available, there are kind of a Nexplanon removal instrument. Our sponges, our 4x4, Band-Aids, steri strip, Coban, Band-Aid scissors, sterile gloves. And you guys are all welcome after to come up and see just kind of what we have here. So we went over these. You're familiar with our iodine, lidocaine. Maybe what you're not familiar though, just different types of the hemostats that we use and that are available. Our scalpels using an 11 blade. Yeah. I'll let you take a look there. Any questions with removal of our Implanon, our Nexplanon? Great. All right.
Do you have good recommendations for referrals or resources for difficult removals?
Yeah. Great question. Typically within your healthcare that you're seeking, they should be able to give you resources if they're unable to remove that device. Yeah.
Just
I don't.
We're all aware,
Yeah.
If you're in Utah, or we have at the University of Utah, our team, the family planning division, like we can definitely, we don't want you to be in a pickle. And a lot of the time, you can call us. We always have an on-call family planning specialist, and we will make sure you have that phone number. So sometimes they can even walk you through. So if you're having a difficult removal, you don't have to go, okay, if you could just go to Salt Lake 2 hours away for this to be removed. Dave, Jen, our providers will be able to FaceTime you, truly, and walk your providers through that complex removal, be able to give some tips about what they should be doing. And it's not like they have to be on FaceTime in front of the client, right? You can go into your office and have a chat for 5 minutes, but we will always have somebody on call. We will certainly have that number because they can probably walk you through a complicated removal.
Great question. Thank you.
So lidocaine with and without?
Yeah.
Manufacturer recommendation?
You know, I found it to be more provider preference. I find that providers have indicated sometimes that it just, that with epi sometimes can increase your heart rate, get you a little excited. And we're already a little excited when we're having these devices inserted, right? Nervous. Our nerves are we're already nervous. So yeah, typically without epi, but provider preference. Good question. Any other questions I can answer? Great. Thank you guys for being here. All right.